Adductor canal is a muscular canal. Where it is situated? It is situated in the medial side, of the middle 1/3 of the thigh. It is bounded by the muscles, and here we can feel the pulsation of femoral artery, and this femoral artery ultimately it is resting over the muscle like adductor brevis. First it rests on the adductor longus, then it rests on other adductor, that is the adductor magnus, okay, and ultimately it passes through an opening in adductor magnus muscle, which is called the adductor hiatus or fifth osteoaponeurotic opening within the adductor magnus muscle. Now, Sir John Hunter actually used to tie the femoral artery in this canal, in this adductor canal. Why? What is the benefit? During its surgical correction of popliteal aneurysm. We know the popliteal fossa is a fossa present at the back of the knee joint, okay, or the back of the knee. Here we get the popliteal fossa, where we get the popliteal artery, and this popliteal artery is nothing but the continuation of the femoral artery when it passes through that adductor hiatus. So, to treat the popliteal aneurysm, it is basically a surgical correction, okay. So, the famous surgeon, that is Sir John Hunter, actually discovered a procedure where he used to tie the femoral artery in the adductor canal. So, it is also called the Hunter's canal. And also that muscle which is called the Taylor's muscle or the sartorius muscle, we know that crosses and the front of the thigh, okay, it is taking origin from the anterior superior iliac spine, it crosses, okay, and ultimately it reaches to the medial side of the upper part of the tibia. So, when it is crossing, it forms a relation, there is a relation of the roof of this canal. So, it is also called subsartorial canal. Okay. Now, we will see So, here we can see this is the femoral triangle, already we know, and this is the sartorius muscle. So, from we know this is the apex of the femoral triangle. From here adductor canal actually starts, and we know this is the part of the femoral triangle and this is the canal, and it ends in the adductor hiatus. So, what is the extent of this canal? It starts from the apex of the femoral triangle and ends in the adductor hiatus of the adductor magnus. So, this is the extent of the adductor canal. Okay. Now, this canal has, if we cut the femur and everything at the junction of upper one third and middle one third, okay. So we will get a triangular cross section. Triangular cross section. This is anterior, this is posterior, okay, and this is medial, and this is lateral, okay. So we can find anterolaterally it is covered by the vastus medialis, okay. It covers the vastus, actually vastus medialis is retracted on this side, okay. Actually it remains adherent with the femur. So this is the vastus medialis. So this is the vastus medialis, okay. And so vastus medialis, it is present. So this is anterior, this is posterior, okay. The shape of the femur, this is the posterior part, which is, we know there is a line which is called linea aspera in the femur, which is directed posteriorly, okay. The triangular cross section of the femur, it is in front, and behind we can get the linea aspera. So posteriorly this is the linea aspera. So this is kothay geli ei dekho. So this is posterior part, this is anterior part. So anteriorly or anterolaterally this is the vastus medialis, and posteriorly or posteromedially this is by the adductor longus in upper part. In upper part we get the adductor longus, in lower part we get the adductor magnus muscle, okay. So in one section we cannot explain the two muscles, either we will get the adductor longus at the level of adductor longus, or at the level, if it is the cross section is below the level of adductor longus, we will get the adductor magnus. So posteromedially we are getting posteromedially we are getting this adductor longus, and laterally or we will get the sartorius muscle, okay. From lateral to medial that muscle is traversing, so we will get the sartorius muscle, okay. So this is the sartorius muscle, okay, and this forms the roof, okay. Again I am repeating, this is anterior, this is posterior. So this is the canal. So canal is bounded in front or anterolaterally by the vastus medialis, posteromedially by the adductor, either adductor longus in upper part and adductor magnus in lower part, and at the roof we are getting, this forms the roof which is formed by the sartorius, and below the sartorius we get a fascia which is called the subsartorial fascia, okay. So this basically the subsartorial fascia which extends from anterior to the posterior part, from anteriorly to the posteriorly. So this extends the subsartorial fascia, and we get the triangular cross section of the adductor canal, okay. And within the subsartorial and just below the subsartorial fascia, within the subsartorial fascia we get a nerve plexus which is called subsartorial plexus or subsartorial plexus of nerve, okay. Just below the sartorius we will get the subsartorial fascia, where we will get subsartorial plexus, and this subsartorial plexus is contributed by medial cutaneous nerve of the thigh, the medial side, also by the another nerve, there is the longest cutaneous nerve, that is the from the posterior division of the femoral nerve, that is the saphenous nerve, a branch from the saphenous nerve. And also there is a contribution by the obturator nerve. Okay. The obturator nerve, a tweak from the obturator nerve. So these three nerves, the medial cutaneous nerve of the thigh, next is a tweak from the saphenous nerve, and tweak from the obturator nerve forms a plexus just below the sartorius muscle, okay, that is that which forms the roof. Just below the sartorius muscle, we get the subsartorial fascia, where we get the subsartorial plexus of nerve. So as a whole, these structures forms the roof of the adductor canal. This is the extent, not so we know this subsartorial plexus, and this is the obturator nerve and medial cutaneous nerve and saphenous nerve. Okay. Now what are the contents? What are the contents? Contents, first femoral artery, femoral vein. Actually femoral artery remains laterally in the femoral triangle, and femoral vein remains medially, but gradually femoral vein crosses this femoral artery, it goes behind the femoral artery, and then it crosses this femoral artery, and it becomes lateral to the femoral artery. Okay. So we will get femoral artery and femoral vein in the adductor canal, but the relation is different. Femoral artery is medial and femoral vein is posteromedial, a posterolateral and ultimately lateral. Okay. And other things we have seen, it is bounded by vastus medialis muscle anterolaterally. So vastus medialis has got its nerve supply from the femoral nerve. We know the posterior division of the femoral nerve, anterior division gives three cutaneous, one muscular. The cutaneous means medial intermediate, lateral intermediate and medial cutaneous nerve of thigh, and only one muscular branch to the sartorius, whereas the posterior division gives 4 muscular and 1 cutaneous. The 1 cutaneous is the saphenous nerve, and other 4 means vastus medialis, vastus intermedius, vastus lateralis, and the vastus. No, there are only 3 vastus. There is rectus femoris. Okay. So there are 3 muscles, 3 vasti and 1 rectus. So altogether 4 muscles, which are called quadriceps femoris. Quadriceps femoris. So vastus medialis has got its supply from the femoral nerve. So we will get the vastus from lateral to medial, we will get the nerve to vastus medialis. Then we will get the femoral vein laterally. Then we will get the femoral artery. Then we will get the saphenous nerve crosses from lateral to medial. So we will get the saphenous nerve. And also we will get most medially another nerve is related, which is related to the adductor canal, that is obturator nerve. And also the last branch from the femoral artery, that is the descending genicular artery. I will show you. So we can see all these structures, nerve to vastus medialis, which will supply this muscle. Okay, nerve to vastus medialis, this is vastus medialis. So, this is the nerve to vastus medialis, okay. And we are getting most medially, this is the obturator nerve which has got anterior and posterior branch, okay, and this is the saphenous nerve. So, these three nerves we can expect. Hello, hello, আমি এখন ক্লাস নিচ্ছি, পরে কথা বলবো আপনার সাথে। So, we will get the nerves which are related to, first is the nerve which is related to this muscle. This is the vastus medialis muscle. So, this is nerve to vastus medialis. Another nerve which will remain lateral, ultimately will cross the femoral artery, that is the saphenous nerve, and most medially this is the obturator nerves, anterior and posterior branch of the obturator nerve. And also we will get femoral artery, and we can get the femoral vein. We can see the femoral artery and femoral vein is becoming posterior to the artery, and ultimately it will move laterally. This picture will clear your idea. So, this nerve, here we are getting the vastus medialis, and this is nerve to vastus medialis, and this is the saphenous nerve which remains lateral and which crosses this artery at the apex of the femoral triangle, and it becomes medial to it, okay. So, this is nerve to vastus medialis, and this is the nerve, that is the, and this is the longest cutaneous nerve, that is the saphenous nerve, which first remains. This is lateral, this is right side, okay, right sided thigh. So, this is lateral and this is medial. So, this is the nerve to vastus medialis, saphenous nerve which crosses this artery and becomes medial, and this is the femoral artery and femoral vein which remains medial to the artery, crosses the artery from the posterior aspect, and first it becomes posterior, then it becomes lateral. And this is the saphenous nerve. This saphenous nerve moves hand in hand with another branch or the last branch from the femoral artery. This is the descending genicular branch. Genicular means, genu means knee. It will go in the, there is an anastomosis which is called genicular anastomosis. There are several arteries which are called medial genicular, lateral genicular arteries, medial superior genicular, medial inferior genicular, lateral superior genicular, lateral inferior genicular. There is an arterial anastomosis. So, it will contribute to that genicular anastomosis. So, it will go to the, genu means to knee. So, this is the last branch from the femoral artery. This is also asked in the postgraduate entrance examination, okay, which one is the last branch from the femoral artery, genicular artery, saphenous artery, several arteries we can tell, okay, okay, superior genicular, inferior genicular, medial genicular, lateral genicular, and only, okay, the genicular branch of the femoral artery, okay, to the descending genicular branch. Okay, so this descending genicular branch along with the saphenous nerve, they are coming down. So, this is another picture where we can see the femoral sheath, then we can see this is the adductor canal, and here in the adductor canal we can see the femoral vein which remains medial to the artery in the femoral triangle, which crosses from the behind and it becomes lateral. And when it passes through the adductor hiatus within the adductor muscle, okay, it becomes popliteal artery and popliteal vein. Okay. So, this is the extent. Extent is from here, this is the apex of the femoral triangle to the adductor hiatus. The same thing, vastus medialis, this is a sartorius muscle, okay, and this is the adductor longus muscle, the formation of the adductor canal. Okay. Now I will show you, I will show you other muscles, okay, the picture of the other muscles, so that you can have that means the adductor group of muscles. We can see this is the hip bone and this is the femur and this is the tibia and this is the fibula and this is the patella. So, this is the medial side and this is the lateral side, and here we can see these muscles. This is the pectineus muscle which is taking origin from the pecten pubis, okay, and it is inserted in the upper part of the linea aspera, that is in the posterior. We know in the shaft of the femur we get several borders. This posterior border is very thick and which is known as linea aspera. Okay. So, this muscle is taking origin from here and ultimately it is inserted over the upper part of the linea aspera. So, this muscle is the pectineus. Then we can get another cart muscle. Cart ends are this upper part and this is the lower part. This is the adductor longus muscle. This why we this part is cut. This part is cut to reveal other two muscles, that is the adductor brevis in upper part, in lower part this is the adductor magnus. Next. You can appreciate pectineus, then is the adductor brevis and which is been overlapped by this adductor longus. And most medially we can see this is also taking origin from the pubis, and there is the conjoint ischiopubic ramus. Okay, we have some idea I think about the conjoint ischiopubic ramus. This is the pubis, this is the ischium, this is ilium, very good. So, from the ischiopubic ramus, because it is common to both, that means it is common to pubis and the ischium also. So, this is the ischiopubic ramus. So, from the inner border this muscle is taking origin, that is the gracilis muscle. This is also a adductor group of muscle and which comes down straightway and it is inserted in the upper part of the tibia. Okay. So, this is pectineus, then adductor longus is cut to reveal the inner muscle, that is the adductor brevis and adductor magnus. So, adductor magnus you can see that these are the muscle fibers and it becomes aponeurotic and there is an opening between this aponeurosis of this adductor magnus and the femur bone. So, this is called the osteoaponeurotic opening through which femoral artery passes. Okay. Chalo. Individual muscle pectineus taking origin from the pecten pubis and inserted in the linea aspera or posterior border of the femur. Similarly, this is the gracilis taking origin from the conjoint ischiopubic ramus and it is inserted into the upper part of the medial side of the tibia. Same thing, same pectineus muscle. Okay, we can see this pectineus muscle. This is the adductor longus taking origin from the anterior surface of the pubis, and it is again inserted into the linea aspera, the posterior border of the femur. So, if it contracts, what will happen? The femur will go inside or outside? What is your common sense? Inside. So, this is adductor muscle. Similarly, if this adductor brevis also is taking origin from the pubis, and it is inserted in the upper part of the linea aspera. If it contracts, okay, it contracts, what will happen? It will go towards the medial side. So, this is again an adductor muscle, and this is the adductor magnus. It has got wide area of origin. It is taking origin from the, you can see this is the ischium, and it is also taking origin from the ischiopubic ramus. These ischial fibers of adductor magnus are not the adductors. Ischial fibers from the ischium, okay, it is taking origin. The ischial fibers are not the adductors. They are the part of the hamstring group of muscle. Hamstring group of muscles are present on the back of the thigh, like semimembranosus, semitendinosus, bicep femoris. They have got some common characteristics. Okay. They extend the hip, flexes the knee. They are being supplied by the tibial component of the sciatic nerve. They are taking origin from the ischium. So, these are the common features. So, except the ischial fiber, the rest of the fibers are which are taking origin from the pubis and the or conjoint ischiopubic ramus. They are the real adductors. Okay. So, again you can see this is the adductor magnus, and here you can see several opening. Opening 1, opening 2, opening 3, opening 4, and this is the 5th opening. So, these openings are made by the deep femoral artery. The deep femoral artery gives so many perforating branches. The deep femoral artery or arteria profunda femoris takes origin from the lateral side of the femoral artery, around 3.5 centimeter below the mid-inguinal point. That means the inguinal ligament, okay, the midpoint of that ligament is the mid-inguinal point. So, it is the arteria profunda femoris. So, it passes and it goes deep to the adductor longus and ultimately gives 3 perforating branches. Okay. First branch, second branch, third branch, they passes through these openings, and 4th one is for the continuation of artery itself. Through the 4th opening, the artery, that means that arteria profunda femoris actually passes through. So, there are 4 openings for the made by the perforating branches and the itself by the arteria profunda femoris, or which is also called deep femoral artery. And the 5th one is for the passage of the femoral artery. Femoral artery is here, it will pass through it and it will become, and here we can see this obturator nerve. Okay. We know the ventral division of ventral rami of second, third and fourth joins to form this obturator nerve, and it ultimately supplies all these adductor group of muscles. It divides into anterior and posterior division, okay, and it supplies the adductor group of muscles. This posterior division actually passes through this opening, okay. That means the fifth through the fifth osteoaponeurotic opening, not only the femoral vessels will move, also the posterior division of the obturator nerve will pass and it will supply the knee joint, okay. This is the obturator nerve, this is the anterior division and this is the posterior division, okay. We can find pectineus muscle, adductor brevis muscle and adductor longus muscle in front, and behind is, this is adductor longus in front, adductor brevis in between, and behind we will get the adductor magnus. So, anterior division will move in between adductor longus and the adductor brevis, and the posterior division will move behind the adductor brevis. So, anterior division will supply the medial part or adductor part of the pectineus, adductor longus and gracilis, whereas the posterior division will supply the, sometimes it supplies the adductor brevis and also it supplies the adductor magnus, and this is obturator externus, and ultimately it passes through the fifth osteoaponeurotic opening.